Good morning, everyone. Such a pleasure to be here. It's my first Pitchfest, and just reflecting on the morning, I'm really blown away by the incredible work of our local government, local and state. My name is Nellie Afshar, and I have the great privilege of serving as the first Deputy Commissioner for the New York City Department of Health and Mental Hygiene. Before we get to our pitches, I want to ground all of us in who we are. The New York City Health Department is the oldest and largest municipal public health department in the country, some would say the world. We act on science and data to pass policies and provide services that create what we think of as an invisible shield, keeping New Yorkers safe in ways they often never see. From restaurant letter grades to nurses and mental health providers in your children's schools, pop-up vaccination sites during the COVID-19 pandemic, life-saving naloxone kits on the front lines of the overdose crisis, and a hotline connecting anyone in the country to abortion care. That's us. Everything we do comes down to one principle. Your health should not be decided by who you are, where you're from, or what zip code you live in. It is the operating mandate of the New York City Health Department. Today, my colleagues and I are here to pitch challenges where we're looking for the right partners, and we hope you're in this room. And now I'll tell you about the first one. So public health is not just about responding to infectious disease or chronic conditions. It starts with meeting basic human needs: food, affordability, food, housing, and affordable care. You cannot talk about economic security without talking about health. And right now, New York City is facing two crises at once: a cost of living emergency that is already straining families, and a federal policy that's going to make it dramatically worse. The tax bill of last summer, known to many as the Big Beautiful Bill, otherwise called HR 1, puts Medicaid coverage, known by the media, let me correct that, puts Medicaid coverage at risk for hundreds of thousands of our neighbors starting in January of 2027. We cannot wait for that wave to hit. The data is concrete. 2/3 of New Yorkers report having to choose between paying their rent or buying their groceries. Nearly 70% felt burdened by healthcare costs last year. These are not abstract statistics. These are what our workforce sees every single day. That's why we're launching the Health and Affordability Navigator, a tool that turns every routine frontline interaction into a doorway for benefits enrollment, housing support, and food assistance. The idea is simple: meet people where they are and remove the friction between a need and a solution. And we're committed to building it with the communities it's meant to serve. But launching it is step one. Proving it works is step two, and that's what I'm here to pitch. We need to quantify impact. Real dollars back in New Yorkers' pockets, health outcomes that shift measurably over time. We're looking for a partner with expertise in health economics and public health return on investment. We're bringing our staff time, our commitment, access to leadership, and real program data. If that's in your wheelhouse, let's please talk. Thank you, and I welcome my next colleague, Caitlin. John.
Thank you, Nellie. Good afternoon, everyone. My name is John Yates, and I have the pleasure of serving as Assistant Commissioner for the Bureau of Health Promotion for Justice-Impacted Populations in the New York City Department of Health and Mental Hygiene. So, New York City is the best city in the world, and I'm not just saying that because it's my hometown. But I think we could all agree that New York isn't without its cracks, maybe some potholes. And the problem is that our most vulnerable neighbors run the risk of falling through these cracks and potholes every day, specifically those with legal system involvement, particularly criminal legal system involvement. And what's wild is that the city spends millions of dollars to support these individuals with a social safety network to help them thrive and live full lives. But the problem is that these collection of resources function as independent islands rather than a more perfect union. And what happens here is that the quality of our care and coordination of that care suffers, and we're talking about some of the most vulnerable neighbors we have. So we at the health department wondered, what if we could integrate and consolidate all of the information, all of the resources, all of the touch points, both city and state, that these individuals interact with, so that when we're supporting them either pre-diversion or post-release or even during their incarceration, we have a full panel snapshot of where they've been, of who's helped them, who we can call. We believe that this integrated platform will greatly improve the care that we provide people, will greatly improve the quality of these individual lives, and help us identify systemic and structural change that we need to see based on the trends that we're identifying between these touch points. So we'll bring a ton of agency staff time, connections with our relationships and our city partners and state partners, as well as a lot of data and proofs of concepts that prove that this resource would work. Excuse me. We're seeking nimble niche technology partners that understand consent-driven interoperable systems. That's a really nice way of saying we need someone who's really good at herding cats. You'll have a lot of partners to work with. We need someone who's really sensitive and passionate about working with this population and empowering them. This is why a consent-driven model is important. And we're really excited with this opportunity because as the city continues to engage and address and grapple with community safety, we believe that healthy communities are safe communities. And for us to have the safe New York City that we deserve, we really need to be thinking about the health and safety of our most vulnerable neighbors. Thank you so much.
You'll be up soon enough, Kate. You're right there. Morning, everybody. Good morning, everybody. I know I'm standing between you and lunch, so I'll make this brief. My name is Bo. I'm a senior planning and policy analyst with the health department. And one word you're going to hear a lot today is affordability. You've heard it a lot already, and I'm sure you'll hear it more throughout the day. Now, I believe that the other side of the coin of affordability is wealth building. So our previous acting commissioner, Dr. Morse, published a seminal white paper around the racial wealth gap and the disparities of health outcomes due to that. So one question that came out of my mind was, how do we design an intervention that is based on wealth building as a health intervention? So the question that we are trying to address and what we're looking for is to identify mechanisms of wealth building. So one example that we've looked at, and we're not set on this, but just as an example, is that the city pour millions, if not billions of dollars into capital investment. So we're thinking about building new sewer pipes, we're thinking about building greenways and parks, different ways in which we improve the infrastructure of the city. Now, because of that improvement, there are knock-on effects. Property values rise, people will come in and buy out buildings, and then people are displaced. So one example that we're thinking of is how do we capture that increase of value and figure out a way to provide that wealth to the lowest income New Yorkers? What we're looking for is a person or organization or entity or whoever to help us find these mechanisms. We want someone that's willing to explore with us, and we want someone who's willing to innovate. And honestly, what we're trying to do is something that is kind of pushing the bounds of like what health departments have traditionally done. And what we can offer, my colleagues have already gone over time and again. We have a wealth of data, a wealth of staff time, and a wealth of people who deeply care about New Yorkers and everyone who lives in the city. And so, the expertise we're looking for, someone with public or financial expertise, anything related to banking or creating loans, and really someone who sees this as a way of removing barriers for people to succeed. So we want to make sure that New York City is not only a place that's affordable to everyone, but also a place where people can reach their dreams. Thank you.
Excellent. All right. Hi, folks. My name is Caitlin Smith. I'm going to start really quick with a little show of hands. Please raise your hand if you have an older adult in your life who experienced an injury from a fall. All right, take a look around, folks. That is a lot of people, right? So this is it's an extremely common thing. The New York City Health Department, we're committed to health equity, and we've recently been bolstering efforts in investing in older adult health. And we see nationwide and in New York City that white older adults have higher rates of fatal and non-fatal falls than Black, Latino, or Asian older adults. And this is quite uncommon as far as health outcomes go. These differences are likely due to a complex interaction of factors, but the disparities are not well understood. So falls, generally speaking, it's quite an interdisciplinary thing. There's a lot of different reasons why someone might experience a fall. But more research is needed to fully understand these factors, and particularly within the context of New York City. And we want to characterize the differences in reported injuries between these groups. So what we're really, the question here, what are the racial and ethnic differences among older New Yorkers who fall or are injured in a fall? And what factors contribute to these disparate rates in New York City? We're hoping to use this research to refine outreach, education, and prevention program for older New Yorkers. And the research will be shared with the New York City Falls Prevention Coalition, which we co-chair with partners from New York City Aging, who are here today. So this is a multi-sectoral group with partners all across healthcare, human services, academic institutions, and more. So there's a really great avenue for us to disseminate any of these things that we've found. And we're really looking for a partner with experience in equity analysis. If you have experience with older adult work, that would be a bonus. Thank you so much.